Hey everyone, so I just wanted to spend this video talking about acne, and this is something I feel is a universal topic for a lot of people, from girls to boys, young and old. I'm 26 and I've been dealing with sort of acne issues from the age of probably 13 on. Um, I never had truly serious acne. The acne that I had throughout high school and puberty and college was mostly blackheads sort of around my nose and cheek areas and the occasional whitehead. And I had gone to dermatologists and sort of my gynecologist and other doctors complaining about my acne issues, and mostly what they just ended up prescribing to me was Retin-A or micro-Retin-A. And I really didn't like it. I didn't see results, right away. And I know that it's something that you need to use for kind of a while before you see results. But I found that it just dried my face out so drastically that I didn't even want to deal with it. So I would always just stop using it. So I wasn't satisfied with that. I tried Proactive, and I also tried Clinique's cleaning skincare system and didn't really see any great results with either of those things. So I kind of was dismayed and thought maybe this was something I was just going to have to deal with kind of for the rest of my life. In the last 6 months, sort of had a lot of life changes. I moved back from Tallahassee to Chicago. I started a new job. My parents moved out of the state. My grandma died, and I moved in with my boyfriend. And so there was all of these sort of crazy changes going on and emotional things going on, and I just started to get the worst acne I've ever had in my entire life. And it was different than anything I'd ever experienced before. The pimples were mostly centralized around my cheek and sort of lip area here. Um, and they were really deep and they persisted and they didn't want to go away. And they left terrible sort of red spots and scarring even though I wouldn't pick them. And when one would finally go away, I'd find, another pimple in the same spot a week or two later. And so I was just beside myself with how to deal with it. So I started buying, creams and face washes and lotions to try to sort of treat and deal with it. And it did get slightly better, but it still didn't really get to the core of the issue. And so finally one day I got so fed up with it that I decided I was going to go to a dermatologist. I got a recommendation from my mom for a doctor in Chicago, which is really good for treating skincare issues. And I can give anyone who's interested the name of this doctor if you're in the Chicagoland area and want to go. He's kind of a no-nonsense doctor. He has a lot of appointments on Saturdays, and they're really quick, short appointments, so there's like back-to-back. He basically comes in the office, asks you a few questions about what your problem is, how you want to deal with it. He looked at my face and then basically prescribed me my regimen. And then he asked to see me in 2 weeks with a follow-up so that he could sort of check on what we were doing. So he's no nonsense, but he's really good. He takes a really proactive stance on how to deal with acne, and he didn't just brush it off. So basically what he has me prescribe me is three different things. The first is a face wipe that I use on my face twice a day. It's called Triaz. It's a benzoyl peroxide pad. I use the 3% foaming cloths, but there's also a 6% one, I believe. And they come in a box of 60 pads. I wash my face in the morning and at night with this. At night, I do use a makeup remover sort of cleanser before using this because you're not supposed to get it around your eye area. And a lot of the eye makeup I have is sort of waterproof, and it's really difficult to get off. So I just try to remove that before I use this pad. But the doctor actually recommended that I cut these pads in half because they are actually bigger than the area you need to wash your face. And that way you actually use half the amount. So I use this in the morning and the evening. And then at night before I go to bed, after I washed my face with this and patted it dry, I apply this gel. It's called Ziana. It's clindamycin phosphate 1.2% and tretinoin 0.025% gel. And this, along with the face pad wash, is supposed to help prevent acne from forming. It's supposed to help sort of treat blackheads and other sort of pimples around your face. And it's also supposed to help, especially the gel, with specifically helping redness to sort of decrease over time. And so I use that at night. The one thing that is kind of funky about this is that it does have a weird sort of smell, but I don't mind so much because it is at night, and once I'm sleeping, it's not really an issue. Then the last thing that I have is it's an antibiotic called Solodine. I use the 45 milligram tablets. So this is basically an antibiotic that you take once a day. to help keep your body free of the bacteria in your face that would cause acne. So I did see a slight increase in a little bit of acne after I started this regimen, but it wasn't anything that was too abrasive that I couldn't handle it, and I was kind of anticipating that. The thing that I was pleasantly surprised about was that I didn't really have any serious dryness issues like I had with the other prescriptions that I had taken in past. There was a slight bit of dryness like the first couple of days I used it, but I used lotion every day and it didn't persist. I've been using this for about 3 weeks now. I went to the follow-up visit with him and he said that he thought it looked better. And I do agree, it does look actually a lot better. He has given me extensions of all the prescriptions, and we're going to see each other again in 3 weeks so that he can check on me again. So I like that he's taking an active stance in wanting to check up on me and seeing how it's working. I have seen a great decrease in the number of blackheads on my nose and cheek area. I haven't seen any of the large, gigantic pimples that I had been dealing with in past. I've had a few kind of random pimples that haven't been too serious and have gone away quite quickly. I have one right now on my chin, but I think that's mostly my body kind of relieving itself of sort of the acne that's already was sort of growing there, probably deep underneath the skin. I'm really happy with the way that this is working. I'm really glad that I went to the doctor, and I really want to share my experience with you because no one should have to deal with acne in this way. And I don't really consider myself to be that vain of a person, but after seeing some of the scarring and redness that this stuff left on my face, I just didn't want to have to deal with that. And I was so afraid that my face is just going to look like that for the rest of my life. And so I decided, I'm going to go and take a stance and decide that this is not the way my skin's going to be. And I'm really glad I did because I think that keeping your face looking good is really important. No one wants to deal with acne. I'm 26 and it's embarrassing to go to work in the morning with, huge pimples all over your face. They're hard to cover, it's hard to wash your face, it's hard not to bump it or not to feel the urge to pick it. So, I feel like this is definitely working. I'm going to see him again in, I think, 2.5 weeks. So I'm hoping by then that it'll even have cleared more and that we'll figure out sort of if I need to continue using this medication. One thing that I do want to note is that when you're taking an antibiotic like this, it can have effects with other prescriptions like birth control. So if you're on something like that, you need to use like backup methods. But, that's just something to consider. And that's not with just this antibiotic, it's with any antibiotic. And you also want to take it sort of at a consistent time every day. Antibiotics work best when they're consistently in your body throughout the day. So I try to take it at the same time every day. You're supposed to take this with water. You're also supposed to stay upright for at least a half an hour after you take it. I don't know if it has something to do with drowsiness per se, or maybe some kind of bodily function like liver functioning. But you should, if you have any concerns and you get prescribed something like this, you should definitely ask if you have any problems with it or anything. But I wanted to put this out there because, this might be helpful for somebody else. This seems to be working really well for me. It's not uber harsh, but it seems to be pretty proactive in sort of dealing with the core issue of my acne problems. But there's lots of treatments out there. There's lots of products you can use. I definitely think if you have acne issues that you should go and take care of it. If you are in the Chicagoland area and want a recommendation for a really good dermatologist and one that's sort of no fuss, no muss, that's going to get the job done, I have the name of a really good doctor. So I hope this is really helpful for you. I hope you have a wonderful day, and I hope that if you are having some acne issues that you do take a stance and decide that you don't want to deal with it anymore. If you have any questions or concerns, or if I haven't touched on any of maybe the things you would like to know about these products, message me and I'll be happy to respond to you. If you have just stories you'd like to tell me about your acne or anything, I'd also like to hear because I am an acne sufferer myself, and so I do feel your pain. Anyways, so have a wonderful day. Sorry for the rant. I just have been wanting to get this off my chest for a while. So, later.